The doctors today are Dr. John Shuk Kwan, Head of Communicable Disease Branch of the CHP, and Dr. Gladys Kwan, Chief Manager of the HA. The doctors will give an Dr. Kwan, please. Good afternoon. There are 2,500 confirmed patients in hospitals. Among them, 235 are newly confirmed patients. For those in isolation facilities, 451 are being treated in isolation wards. 132 patients are being treated in second-tier wards. 492 are undergoing treatments in the North Lantau Hong Kong Infection Control Center. 194 patients are in AWE. 145 patients are newly confirmed patients. Yesterday, we reported 10 patients in critical conditions, 7 in serious condition. Among the inpatients, 56 are critical and 49 are serious. Among them, 20 critical patients are in ICU. So we would like to report one critical case today. That is a 2-year-old child, a boy, with no medical history. He lives with his parents. On the 30th of August, he was given 1 dose of vaccination. On the 18th of September, he had a fever. On the 19th, his RAT returned positive. He began displaying upper respiratory symptoms, including cough and a runny nose with a high fever. His parents brought him to our designated clinic. The doctor considered his clinical condition unstable and referred him to the emergency A&E. So he began to display seizures, and he was sent to our pediatric ICU department. He's now relying on breathing equipment and drugs to maintain his vital signs. He's in a serious condition. He has a cerebral edema, so we suspect the condition to be an acute brain condition. We have prescribed him with antiviral drugs and other supporting treatments. So we will continue with all the measures to help him, and we will continue to support his family. Now, we would like to appeal to the public. Since the beginning of this year, more than 1,100,000 children under 12 have been infected. 9 children have passed away. So this is something that we definitely not want to see. At the peak, we had 160 pediatric patients in hospital with more than 20 in critical or serious condition. For children, their anti-epidemic awareness and immunity is lower and the risk is higher. Vaccination is the most effective tool to protect children against the virus. That's why we once again appeal to parents to get your children vaccinated. It will prevent acute complication, serious condition, or even death, and also long COVID after infection. Please get your children vaccinated as soon as possible to boost their defense against the epidemic. Concerning death, we have reported 7 new deaths, including 4 males and 3 females, aged between 43 and 92 years of age. Among them, 6 were not fully vaccinated with 3 doses. So I mentioned a rather young deceased patient that was a care home resident. Because of the outbreak, the patient was sent to the AWE for isolation, rather quarantine, and that, afterwards, subsequently, the patient was confirmed. The patient had a genetic disease which require personal care, and the patient was bedridden. The situation turned for the worse, and the patient got a lung complication, and the patient passed away yesterday. The patient was not vaccinated. So for the majority of the disease patients being reported today, most of them did not receive any vaccination. It may be due to various reasons. Still, we once again appeal to the public, if you have not completed the vaccination course, please make haste and get vaccinated to protect yourself and your family members. 366 patients have recovered, including 331 patients discharged. 9 patients were tested positive on admission screening. 15 patients in the same ward were classified as close contacts. For our staff, another 101 hospital authority staff members are infected, and 70 colleagues have returned to their positions. I would like to make an announcement. At the Castle Peak Hospital in the male ward, a nurse was tested positive on the 20th. The hospital has arranged thorough testing for all the patients. 3 other male patients are now confirmed to be positive. 12 patients in the same ward are listed as close contacts and are undergoing quarantine. The situation is stable. The ward has ceased taking in new patients and also stopped visiting arrangements. Disinfection has been carried out. Thank you. Dr. Zhuang. Good afternoon. Yesterday, we reported 5,459 new cases locally, including 1,348 PCR tests positives and 4,111 RAT positives. And we had 135 imported cases, including 119 PCR and 16 RAT positives. Among the 135 imported cases, 66 were caught at the airports. And also at a quarantine center and quarantine hotel, 26 cases were found. At community quarantine, community testing centers between the 4th and the 7th day, there were 43 cases. For the 8th to the 10th day, no new cases have been found. The 135 cases are from 38 places, with 5 places having imported more than 10 cases, including the UK 17, the Philippines and Thailand 15, the US 12, and Indonesia 12. For the remaining 33 places, 10 or less cases have been imported. Dr. Guan mentioned we have reported 7 deaths today. In the 5th wave, the total number is 9,695. In terms of care homes, yesterday, 6 residential care homes for the elderly people and 4 residential care homes for people with disabilities have reported 12 residents infected. 55 residents are undergoing quarantine. For schools, today is Tuesday, we have 589 schools reporting 1,007 cases, involving 878 students and 129 teaching staff. The 1,007 cases are from 138 kindergartens and child care centers, 224 primary schools, 211 secondary schools, and 16 special schools. So the 366 schools have reported more than 2 cases in the past 7 days. We have yesterday afternoon and this morning, we have advised 28 schools to cease in-person classes for 1 week for 32 classes, including 12 kindergartens and childcare centers, 6 primary schools, 8 secondary schools, and 3 special schools. Previously, 4 schools were advised to suspend for 1 week. So one class is reporting outbreak for each school. So they include 2 kindergartens, 1 primary school, and 1 secondary school. In terms of subvariants,
So L
So for L452R on the 19th, has reached 86.2%. And if we look at the community levels, BA.5 percentage is around 79.6. So that's close to 80%. BA 2.2 is 11.5%. BA 0.4 is 6.6%. BA 2.12.1 is 2.3%. That's all I have to report today. We now move on to the Q&A session. Please use the microphone. Our staff hands over to you, and please identify your media organization before you speak. Thank you. Good afternoon from Ming Pao. I'd like to ask about the 2-year-old who is in critical condition. How bad are his seizures? Do you have the CT value of the PCR test? Are his family members infected as well? Do you know where his source of infection comes from? I also like to ask about the 43-year-old death. Is he a male or female? Do you have more information on the outbreak of the elderly home he lives in? And as of today, how many people or how many staff of the HA cannot report to work due to COVID? Would you consider actually relaxing some of the measures for the hospital staff, because some doctors have suggested that they can return to work by wearing high protective masks. So would you consider going back to phase 2 of the hospital beds deployment plan? And how do you define which wave of the pandemic we are in right now, because we are now moving on to new variants? So why are we still in the 5th wave, or are we already in the 6th wave? How do you assess that? Let me first take some of the questions. We're still in the 5th wave, and you can see that the numbers are coming down gradually, and we hope to see this trend continue. As regards to the 2-year-old, he was suffering from upper respiratory symptoms when he was admitted into hospital, but he was not feeling too well and was not too conscious after admission. So some medication had to be used to help with his seizure. He also had breathing difficulties. Therefore, the ICU took him in and helped him with his breathing by providing him with support. The CT value was 18.1 on his PCR. That means that the viral load is very high. The 43-year-old who passed away was a female patient. She lived in an elderly home in Tuen Mun. I do not have a lot of information on the outbreak of the elderly home at this moment. For close contacts of hospital staff, today, we have about 662 close contacts of confirmed COVID patients. So you can see that the number of close contacts of HA staff have also been dropping. We are now looking into whether there is room to relax measures in the work environment, such as providing more protective equipment for them. As we mentioned yesterday, we continue to review the figures on the capacity of beds, admission figures, confirmed staff numbers, etc. We know that there are still some needs for non-COVID patients, and we continue to adjust our services. We continue to observe the upcoming situation before we move on to other deployment plans. Thank you. The gentleman over there. Hello from AM 730. Well, we see there's been a drop in the confirmed numbers, is there a possibility to further relax social distancing measures? There are 28 schools with 32 classes that have to be suspended for a week. Can you tell us more about that? Yesterday, Professor Yun Kok-yong, together with some other experts, suggested that we should triage vaccinated and unvaccinated COVID patients. So would you actually consider doing that in your admission of patients? I'd also like to ask whether the 2-year-old family members are also infected. Currently, those who depart Hong Kong do not actually have to go through temperature control. So is there a reason for that? Do you need to strengthen up the measures for that? Out of the 29 schools, 32 classes have to be suspended. And there are 3 schools with 2 classes that have to be suspended for 1 week. So they're not concentrated in just 1 or 2 schools. The pandemic seems to be slowing down, and the government is continue its monitoring on the trend to see whether measures could be relaxed. To provide more information on the 2-year-old, we know that the family members conduct RATs every day. At this moment, the family members are not infected and they do not have any symptoms. We have heard views from many experts. However, many arrangements need to be made to ensure a smooth flow of admission procedures. When the numbers start dropping, we can consider adjusting services for non-COVID patients and to resume normal operations as soon as possible. We continue our discussions every day, and of course, we would be happy to listen to views from experts, but it also depends on our internal situation.